I need you to stop everything you're doing right now, and listen to me carefully for the next few minutes. Because what I'm about to tell you today, might be the most important thing you'll hear this year. I am Dr. William Carter, a cardiologist with over 25 years of clinical experience, and throughout my career, I have witnessed something that still keeps me awake at night. Perfectly healthy people, who woke up in the morning, had coffee, chatted with their family, and a few hours later were on an emergency stretcher. Without warning. Without intense pain beforehand. Without any obvious signs. And when I asked family members, did she ever complain about anything? The answer was always the same. No, doctor. She was fine. But she wasn't well. Her blood pressure had been high for months, maybe years. And her body was signaling it, but no one knew how to recognize those signs. This happens every day. All over the country. With people aged 60, 65, 70. Who consider themselves healthy because they don't feel anything. And that is precisely the danger. High blood pressure doesn't hurt. She doesn't warn you. It works silently, pressing on your arteries, overloading your heart, damaging your blood vessels, day after day, while you believe everything is fine. And then, when you least expect it, she acts. A stroke. A heart attack. A hypertensive emergency. And the statistics are brutal. High blood pressure is responsible for more than 54% of all strokes and almost half of all deaths from heart disease in the United States. But here's what nobody tells you. Most of these tragedies were preventable. Not because the person didn't have access to a doctor. Not because the medicine was too expensive. But simply because they didn't know what was happening inside their own body. And today I'm going to change that for you. In the next few minutes, I'm going to show you the signs that high blood pressure sends before it strikes. The mistakes most people make without realizing it, the everyday habits that are silently destroying your arteries, and what you can start doing today to protect your heart. Stay with me until the end, because the most important information comes in the second half of this video. And it could literally save your life. Before we continue, I want to talk to you about something that many of my patients have been asking me about lately. There is a natural method that many people are using to help control their blood pressure, in a safe, practical, and uncomplicated way. It's called a Digital Book 30-Day Blood Pressure Reset. And only today, those who access it will also receive 2 free digital books to complement this method. The link is in the pinned comment below, and also in the video description. Now, let's get down to what really matters. I always tell my patients, the problem isn't high blood pressure itself. The problem is not recognizing it in time. And that happens because her symptoms are too easy to ignore. Have you ever woken up with a mild headache in the back of your neck? That heavy feeling, almost as if your head were too heavy. Most people think, I slept badly. It'll pass. But I'll tell you what I tell all my patients over 60, a persistent headache at the back of the head, especially early in the morning, can be a classic sign of high blood pressure. It's not a guarantee. But it is a warning. And warnings should be taken seriously. Now tell me something. Have you ever had that feeling that your heart beat differently for a second? As if it skipped a beat? This is called palpitations. And although it can have several causes, when it occurs frequently in people over 60 with uncontrolled blood pressure, it's the heart crying out for help. I've seen many patients throughout my career who reported palpitations weeks before a serious cardiac event. And when I asked if they had spoken to their doctor about it, most said no. Because, it seemed silly. It's never nonsense. Never. Another symptom that almost everyone ignores, is fatigue without apparent reason. Not the tiredness from a hard day. I'm talking about that tiredness that appears out of nowhere, at rest, when you haven't done anything special. You get up from your chair and feel like you have no energy. You climb a flight of stairs and get out of breath faster than before. You sleep 8 hours and wake up exhausted. When blood pressure is consistently high, the heart works harder than it should to pump blood. And this extra effort drains your energy. But there's more. Blurred or hazy vision suddenly. Ringing in the ears. A feeling of imbalance, as if the ground were moving. These three signs together are a red flag. I have a patient, Mrs. Margaret, 67 years old, who came to see me after months of tinnitus. She thought it was an age-related hearing problem. When we did the tests, her blood pressure was 178/110. At a level that doctors call a hypertensive crisis. She was steps away from having a stroke, and was looking for an audiologist. That's the deceptive power of high blood pressure. It mimics other problems. It disguises itself. It makes you look in the wrong direction. And there is one symptom that is perhaps the most dangerous of all, because it is completely imperceptible. No symptoms. Yes. About 30% of people with severe hypertension feel absolutely nothing. Blood pressure can be at 160, 170, 180. And the person feels perfectly fine. They go to work, take care of their grandchildren, do their normal activities, while inside, the damage is being done. That's why high blood pressure got the name that doctors use among themselves. The silent killer. Therefore, monitoring blood pressure regularly is not optional for those over 60. It's a matter of survival. Now I need to talk about a very sensitive topic, but one that I can't ignore. Because this mistake. I see it happen every day in my office. And it has already cost lives. The mistake of stopping the medication. You receive a diagnosis of hypertension. The doctor prescribes medication. You take it for a few weeks, your blood pressure normalizes, and then you think, I'm cured. I can stop now. This is one of the most dangerous mistakes a person with hypertension can make. Antihypertensive medication does not cure hypertension. It controls it. There is a huge difference between these two words. When you stop taking the medication, the blood pressure returns. Often higher than before. And this fluctuation, this back and forth of blood pressure, is extremely harmful to the arteries and the heart. I've seen patients who suffered strokes precisely during this period of abrupt medication withdrawal. But there's a second mistake that's equally dangerous, and more subtle. Taking the medicine, but at the wrong time. It may seem like a minor detail. It's not. Some blood pressure medications have their effectiveness linked to the time of day they are taken. There is even a field of medicine called chronopharmacology, that studies exactly that. Studies published in the European Heart Journal have shown that taking antihypertensive medication at night significantly reduced the risk of serious cardiovascular events compared to taking it in the morning. This doesn't mean you should change your medication now without consulting your doctor. On the contrary. This means you should ask your doctor, what is the best time for me to take this medication? It's a simple question. And the answer can make a huge difference. Third mistake, mixing medications without informing the doctor. This happens a lot. People take their blood pressure medication, but they also take an anti-inflammatory for back pain. Or a nasal decongestant. Or a supplement that a neighbor recommended. What many people don't know is that common anti-inflammatory drugs like ibuprofen and naproxen can raise blood pressure and reduce the effectiveness of antihypertensive medications. Nasal decongestants containing pseudoephedrine constrict blood vessels and can cause a spike in blood pressure. And some supplements that seem harmless, like licorice, guarana in high doses, and even ginseng, can interfere with blood pressure control. I always tell my patients, before adding anything to your routine, whether it's medication, supplements, or medicinal tea, talk to me. Because what seems harmless, may not be. And the fourth mistake, which is perhaps the most common of all. Do not measure your blood pressure at home. The doctor's appointment happens once every 3 months. Sometimes every 6 months. But the pressure varies every day. It varies with stress. With sleep. With diet. With the weather. Having a blood pressure monitor at home, and knowing how to use it correctly, is essential. And there's a phenomenon that doctors know well: white coat hypertension. Some people only experience high blood pressure when they're at the doctor's office, because of the anxiety of the appointment. And others have the opposite problem: normal blood pressure at the doctor's office, but high at home. Without measuring at home, you don't have the complete picture. And without the complete picture, not even the best doctor in the world can help you properly. Now I want to talk about habits. Because one thing modern medicine has learned in recent decades, is that high blood pressure is rarely just genetic. Lifestyle plays a huge role. And there are habits that seem completely harmless, that are silently raising your blood pressure every day. The first one is the hidden salt. I'm not talking about the salt shaker on the table. Everyone already knows they should avoid that. I'm talking about the sodium that's hidden in processed foods. A chicken bouillon cube can have more than 800 milligrams of sodium. A slice of industrially produced white bread can have 200 milligrams. Canned tomato sauce, ketchup, ready-made seasoning, processed cheese. The American Heart Association recommends that adults with hypertension consume no more than 1,500 milligrams of sodium per day. But the American average is over 3,400 milligrams. More than double. And this excess sodium causes the body to retain water, which increases blood volume, which increases pressure on the artery walls. It's a simple equation. And one ignored by millions of people. The second habit is chronic sedentary behavior. I know many of you have heard this before. But I need to say it in a way you may never have heard before. Sitting for more than 8 hours a day is as harmful to the heart as smoking. That's no exaggeration. That's what the research shows. When you remain still for long periods, blood circulation slows down, blood pressure tends to rise, and the heart needs to work harder to maintain the flow. And the problem for those over 60 is that a sedentary lifestyle often comes disguised as rest. I've worked hard my whole life. Now I deserve to rest. I understand that feeling completely. And rest is important. But there is a difference between healthy rest and chronic immobility. I'm not asking you to run a marathon. I'm saying that 30 minutes of moderate walking, 5 days a week, can reduce systolic blood pressure by up to 8 millimeters of mercury. This is the same thing that some medications do. The third habit, and this one I need you to listen to very carefully. It's untreated chronic stress. We live in a culture that has normalized stress. Everyone is stressed. That's just how it is. It's part of life. But what happens in your body when you live under constant stress is a hormonal cascade that raises blood pressure, inflames arteries, and dramatically increases cardiovascular risk. Cortisol, the stress hormone, when chronically elevated, causes vasoconstriction. The arteries narrow. The heart pumps harder. Blood pressure rises. And for people over 60, who often carry the burden of worries about health, finances, family, this chronic stress is a cardiovascular time bomb. I always tell my patients, managing stress is not a luxury. It's medicine. The fourth habit is sleeping poorly. Sleep apnea. Insomnia. Waking up several times during the night. Studies show that people who consistently sleep less than 6 hours a night have a significantly higher risk of developing hypertension. And during normal sleep, blood pressure naturally drops by about 10 to 20%. This phenomenon is called nocturnal dipping. When sleep is fragmented or insufficient, this dipping doesn't happen. Blood pressure remains elevated all night. And the heart, which should be resting, remains under pressure. If you snore heavily, wake up choking, or your partner says you stop breathing during sleep, please investigate sleep apnea urgently. It is one of the most underestimated risk factors for stroke and heart attack. And the fifth habit, which affects millions of people and is treated with alarming normalcy. Alcohol. I'm not talking about alcoholism. I'm talking about a glass of wine with dinner. A beer on the weekend. A social drink. Moderate alcohol consumption in people with established hypertension may be enough to raise blood pressure and reduce the effectiveness of antihypertensive medications. The American Heart Association is clear: for people with high blood pressure, the ideal is to avoid it completely, or limit it to the minimum possible. I know this is hard to hear, but I'd rather tell you the truth here than have you find out in the most painful way possible. Now I want to give you some good news. Because up until now I've talked a lot about risks, mistakes, and dangers. And I needed to do that, because you need to understand the seriousness of the problem in order to take the right measures. But medicine has also given us powerful tools to combat hypertension naturally, and I want to share the most important ones with you now. The first is something I call a smart cardiovascular diet. It's not a fad diet. It's not so restrictive as to be impossible to follow. It's a way of eating that has been scientifically proven to protect the heart. And the most studied protocol for this is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. Studies published in the New England Journal of Medicine have shown that the DASH diet can reduce systolic blood pressure by up to 11 millimeters of mercury, without any medication. The principles are simple: more fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Less sodium, less saturated fat, less processed sugar. And there's a specific nutrient I want to highlight, that plays a particularly important role in blood pressure control: potassium. Potassium acts as a counterbalance to sodium. It helps the kidneys excrete sodium, relaxes the walls of blood vessels, and naturally reduces blood pressure. Foods rich in potassium: bananas, avocados, sweet potatoes, spinach, white beans, salmon. Including these foods regularly in your diet is not just healthy. It's a cardiovascular strategy. The second solution is deep, controlled breathing. This may sound too simple to be true. But science confirms, deep breathing techniques, when practiced regularly, activate the parasympathetic nervous system, which is the body's rest and recovery system. And when this system is activated, the blood vessels relax. The heart slows down. The blood pressure drops. There's even an FDA-approved device called Respirat that uses guided breathing to lower blood pressure. It was developed precisely based on this science. But you don't need a device to get started. The simplest technique. Inhale deeply through your nose for 4 seconds, hold for 2 seconds, and exhale slowly through your mouth for 6 seconds. Repeat this for 10 minutes, twice a day. It's free. It's safe. And studies show blood pressure reductions comparable to some low-dose medications. The third solution is magnesium. Magnesium is an essential mineral that participates in more than 300 biochemical reactions in the body, including the regulation of blood pressure. And magnesium deficiency is extremely common. It is estimated that more than 50% of adult Americans do not consume enough magnesium. Food sources rich in magnesium: pumpkin seeds, almonds, spinach, black beans, dark chocolate with a high cocoa content. But before starting any supplementation, talk to your doctor. Magnesium can interact with some medications and is not suitable for everyone. The fourth solution, and this one is powerful, is regular outdoor walks. I've mentioned hiking before, but I want to delve deeper. When you walk outdoors, especially in natural environments like parks or gardens, something happens that goes beyond physical exercise. Contact with nature reduces cortisol levels. Exposure to sunlight regulates circadian rhythms and improves sleep. And the very rhythm of walking has a meditative effect that reduces anxiety. Japanese research on the concept of forest bathing, or Shinrin-yoku, has shown measurable reductions in blood pressure after just 15 minutes of walking in a natural environment. It doesn't have to be a forest. A neighborhood park will do. What matters is going out, walking, breathing. And the fifth solution which I see transforming the quality of life of my patients over 60 years old. It's about managing stress through mindfulness and meditation practices. I know some of you are thinking, "Doctor, meditation isn't for me." But I'm not talking about sitting in the lotus position and emptying your mind. I'm talking about dedicating 10 to 15 minutes a day to simply sit in silence, focus on your breathing, and let thoughts pass without clinging to them. A meta-analysis published in the Journal of Hypertension analyzed 23 studies on meditation and blood pressure, and the results were consistent. Regular meditation practices reduced both systolic and diastolic blood pressure in a clinically significant way. Apps like Calm or Headspace have specific programs for beginners. Many are free or have trial periods. Start with 10 minutes. Just 10. And observe what happens to your body in the coming weeks. Now I want to talk about something that, in my experience, is where the most lives are saved. The right tests, done at the right time. Because the most effective treatment in the world doesn't work if the problem is discovered too late. And unfortunately, I've seen this happen more times than I'd like to count. The first test that every person over 60 should have regularly is a home blood pressure measurement. Not just in the office. At home. Ideally, measure in the morning, before taking any medication, and at night, before going to sleep. Write down the results. And take this record to your doctor. Blood pressure readings above 130/80 are considered hypertension according to the most recent guidelines from the American Heart Association. And for people over 60, values consistently above 140/90 should be evaluated urgently. The second crucial test is the echocardiogram. Many people have never had one. And when I talk about this exam, I often hear, "But I've never had heart problems." That's exactly why you should do it. An echocardiogram is an ultrasound of the heart. It shows the size of the heart chambers, the function of the valves, and the pumping capacity of the heart muscle. When blood pressure remains high for many years, the heart begins to change. The wall of the left ventricle thickens in a process called ventricular hypertrophy. This process significantly increases the risk of arrhythmias, heart failure, and sudden death. Echocardiography detects this process. And when detected early, it's completely treatable. The third exam, which is simple and accessible, but which many people have never taken. It is the ankle brachial index. It sounds complicated. But it's basic. The doctor measures the pressure in your ankle and your arm, and compares the two values. This test detects arterial blockage in the legs, an early sign of systemic atherosclerosis, which indicates that the arteries of the heart and brain may also be compromised. The fourth test, especially important for men over 60, is a carotid ultrasound. The carotid arteries are the large arteries in the neck that carry blood to the brain. When these arteries accumulate fatty plaques and calcification, the risk of stroke increases dramatically. Carotid ultrasound is painless, radiation-free, and can detect this process before any symptoms appear. If you have hypertension, high cholesterol, diabetes, or a family history of stroke, this test should be on your list. And the fifth test, which I consider fundamental for anyone with hypertension. It is a complete lipid panel with ultrasensitive PCR. The lipid panel measures total cholesterol, LDL, HDL, and triglycerides. But high-sensitivity CRP, high-sensitivity C-reactive protein, goes further. It measures the level of systemic inflammation in the blood. And in recent years, cardiology has learned that inflammation is just as important as cholesterol in determining cardiovascular risk. People with elevated CRP, even with normal cholesterol, have an increased risk of heart attack and stroke. And this marker responds magnificently well to the lifestyle changes I mentioned earlier. Anti-inflammatory diet, regular exercise, stress management, all of these reduce CRP. This means you can literally see, in your blood tests, the positive results of the changes you're making. And for me, as a doctor, there is no greater motivation for a patient than seeing the numbers improving. I know that receiving all this information at once can seem overwhelming. And I understand. I really understand. Many of my patients arrive at the office overwhelmed, not knowing where to begin, afraid of doing something wrong. So let me simplify everything for you. Don't try to change everything at once. It doesn't work. Behavioral science shows us that sustainable change happens when it's done gradually, one at a time. So here's what I suggest you start with today. First, if you don't have a blood pressure monitor at home, buy one. Automatic arm monitors are affordable and reliable. Measure your blood pressure tomorrow morning, before eating and before taking any medication. Write down the result. Second, look at what you're going to eat today. Is there anything very salty? A processed product that you could replace with something more natural? Make one substitution. Just one. Third, schedule a 30-minute walk tomorrow. It doesn't need to be intense. A comfortable pace. Outdoors, preferably. Just 30 minutes. Fourth, tonight, before bed, practice 5 minutes of deep breathing. Inhale through your nose for 4 seconds, hold for 2, exhale through your mouth for 6. Do this while lying in bed. Fifth, schedule an appointment with your doctor this week. Bring your blood pressure readings. Ask about the tests I mentioned. 5 simple actions that you can start today. Because your health can't wait for the perfect moment. The perfect time is now. I want to end this video with something I tell all my patients at the end of the consultation. You've made it this far. You've stayed here all these minutes, because you care about your health. Because you want to live better. Because you want to be there for the people you love. And that is already the first step. Silent high blood pressure can seem invisible. But now you know what to look for. You know the signs it sends. You know the mistakes to avoid. You know the habits that need changing. And you know the natural tools that can help your heart work with less effort and more efficiency. You don't need perfection. You need consistency. One day at a time. One change at a time. I believe you are capable. And your heart deserves this care. If you want to start managing your blood pressure intelligently today, access the digital book Point 30-Day Blood Pressure Reset. Buy today, and get 2 more free digital books. The link is in the pinned comment below, and also in the video description. Take care of your heart. Because it has been taking care of you, for over 60 years. Until the next video.